Seizures. What are seizures? Anyone? As we all know that brain is working on electric impulses. Our brain have electrical activity. Any abnormal or uncontrolled electrical activity in brain cause seizures. Right? How we can define seizures? Uncontrolled electrical activity in brain cells. What is brain cell? What is brain cell? Neuron or nerves. They are called brain cells, and all the neurons are interconnected by synapses or neuro junctions, and electrical activity is responsible for taking these impulses from one neuron to other neuron. Like for example, if I have, this is the neuron, right? And every myelinated neuron have the intermediate tubule in between the myelinated axon, right? For example, this is the intermediate tubule, right? And there are two very important proteins. They are called dynein and kinesin. Dynein is present here. For example, this is dynein and this is kinesin, right? How this neuron follows the electrical activity? They have a lot of channels: sodium, potassium, calcium, right? And all the channels are voltage gated, right? Voltage gated means that, for example, if I have these sodium channels, it will take this voltage from this calcium channel. Today we will try to cover all about the seizures. There are 10 main causes of seizures, 3 main types of seizures, and there is some specific treatment for seizures which is not clear yet. Only one type of seizures treatment is clear, which is called the status epilepticus. Right? And also we will discuss the difference between epilepsy and seizures, and how the as we know that angina leads to MI, which thing is responsible for leading to seizures. We will discuss this in detail, right? For example, from here this calcium will goes inside, it will provide the voltage to these channels, and these sodiums will be goes inside, and this neuron will be depolarized, and this impulse is generated, and it moves this protein in axon, right? This is normal electrical activity. When this electrical activity is abnormal means uncontrolled, it will cause seizures, right? There are 3 main effects of seizures on body. Who can tell me? 3 main effects of seizure. If you forgot all the things about seizures, you must know these 3 things, right? The 3 things are, we can define the seizure. This is the uncontrolled electrical activity in brain cells which temporarily cause these 3 points. Number 1, it will affect muscle tone or muscle movements. This is the first point. It will affect, mean that muscles will be stiff or twitched after seizures or in seizures, right? The second thing, it affect behavior of patient. How? It causes the patient irritable. Irritability is caused by seizures, right? This is the second point. The third point is, for example, if you are touching the patient, he will be jumping or he will be crying. This is irritability. So mood and behavior changes occurs in seizures, right? The next thing is It affects the patient's sensations. Sensation means state of awareness. In just few seconds we will discuss that this patient will pass from three phases: delirium, right, stoppers and coma. After that seizures will occur. Seizures are of many types. In some seizures the patient will be unconscious, or in some types the patient will be in aware state, right? But in severe cases after coma seizures take place, right? So state of awareness will also affected, mean that in seizure the patient will be confused, he or she will not be relaxed. What are seizures के नहीं seizures के brief seizures. The next, what are the causes of seizures? What are the main causes of seizures? The main causes mean that the actual causes, scientific actual causes of seizures. Seizures are not yet cleared, right? So we discuss the causes of only the tonic, clonic seizures, mean generalized seizures, right? So causes of tonic, clonic seizures. We also call these seizures generalized seizures, right? The first cause, the very important, hypernatremia. Hypernatremia. The second cause is hyponatremia. As we have discussed that sodium is very important for this transport of impulse in neurons. So if the sodium level in body is decreases or increases, it will cause the uncontrolled movements of impulses in neurons and it will cause seizures. What is the normal value of sodium? Normal serum sodium level जी 0.9. Normal sodium range or level in serum, that is from 135 to 145 milli equivalent per liter or milligram per dl, right? This is the normal value of sodium in body. So if this sodium level in body increases or it exceed 145, it will affect the normal activity of brain, or when it decreases from 135, it will also affect the brain activity, right? The second thing, you all know about this cause, hypoxia. How hypoxia causes seizures? Because I have told you that brain have two fuels, glucose and oxygen. And if the oxygen level decreases in body, it means that our brain cannot get the enough oxygen and it will affect the brain, right? Hypoxia is also the cause of seizure. The next is hypoglycemia. These two are very important. Hypoglycemia means decreased sugar level in body. Decreased sugar level mean that we have normally in RBS, our fasting blood sugar level is from 70 to 110. RBS is from 110 to 160 or 170, right? So when these values are decreases from 70 or 110, in random blood sugar is decreases from 110, and when fasting blood sugar level is decreasing from 70, it will affect, because our brain have two fuels and our brain is dependent upon two fuels, the oxygen and glucose. So if oxygen is decreases, the brain will affect. If glucose is decreases, brain will also affect, and it will cause the abnormalities of the electrical activity in brain, right? The next cause is CNS infections. 5 CNS infections. Any type of CNS infection, any type of central nervous system, brain and spinal cord infection. like meningitis, like meningitis, encephalitis. The next is anatomical injuries to CNS. When we got some anatomical injuries in our brain, like for example, if we have hemorrhages, brain hemorrhages, right, or if we have some tumors in our brain, right, these will also cause 6 number CNS anatomical injuries. Right, for example, we have trauma. Trauma will cause EDH या EDH, extradural hematoma, SAD, SH, subarachnoidal hematoma, right? These are ventricular bleed. These are the traumas of brain, right? The next is stroke. What is stroke? What is stroke? Simply it is called brain death. Brain death, right? When brain cells are not getting enough oxygen, enough glucose, it will die or it will stop working, right? This is called stroke, right? So this stroke is can be occur due to hypertension, due to ischemia, right? So stroke is also the cause of seizure. The next is tumor, mean brain carcinoma, brain tumors, also responsible for causing seizures, right? The next cause is it can be occur due to hypomagnesemia. But this is rare. That is very rare, right? Hypomagnesemia. 7. Hypomagnesemia. What is the normal value of magnesium? What is the normal value of magnesium in serum? Does pathology na vele? The normal value of magnesium is 1.7 to 2.2 milligram per dl. Right? If this value is decreases from 1.7, it will affect the brain, and if the brain is affected severely, it will cause seizures. Right? The next cause is when you withdraw the patient directly from barbiturates. Aga medicines. For example, if a patient is using Benzodiazapines, bromazepam, lorazepam, alprazolam, etc., and you directly withdraw these medicines from patient, the brain activity is addicted with alprazolam, bromazepam, or benzodiazepines, all class, and when you stop directly, the brain activity will reduce directly. This is like hypertension. When a patient have blood pressure, like for example 250, 240, 210, and you directly decrease the blood pressure from 220 to 120, the patient must cause by brain death. Why? Because brain is getting enough blood and you directly stop that blood, and the heart is not able to reach that blood to brain. This is also when the brain activity is dependent by bromazepam, alprazolam, etc., and you directly stop this medicine, it will affect the electrical activity of brain. Right? The next class, withdrawal of संज्ञा कभी हुआ है? High barbiturates withdrawal also affect the brain activity. Right? For example, we have amobarbital, phenobarbital, methohexital, etc. These drugs are also used for the treatment of seizures, but when you withdraw the medicines from patient directly, it will cause convulsions, fits, coma, and seizures. Right? The next cause is cocaine toxicity. Cocaine toxicity. Cocaine is CNS stimulant. Cocaine is CNS stimulant, right? And when you get this cocaine and toxic dose, it will cause seizures. The chest की चर्चा because in empty stomach the absorption is on high level. So these are the causes of seizures, right? The next is hepatic failure. Next cause is hepatic failure, because when your liver is not working, your metabolism will wholly solely affected, and your brain, your other organs will not get the enough nutrients, right? So hepatic failure is also the cause of seizures. Next is uremia. Uremia means when you have increased creatinine level. When you have increased creatinine level, it is called uremia, and it is also the cause of seizures. What is normal values of creatinine? Zero to 0.2 or 0 to 1 is normal. When your creat is increases from 1, 1.2, 1.3, 1.4, right, it means that your kidneys are not working properly. And when your creat is crossed 4 or 5, you will be on dialysis, right? So creat is also affect brain, right? These are the causes of seizures, right? Now we will go for diagnostic test, and you will tell me which test I will advise to the patient who is caused by seizure. Diagnostic test. Diagnostic tests. Can EEG? Can I advise EEG? Electroencephalogram, a procedure by which we can calculate or we can measure the electrical activity of brain. ECG, what is ECG? By ECG we are calculating or measuring the electrical activity of heart. By EEG we are calculating or measuring the electrical activity of brain. But I cannot advise EEG directly. This is one of the big mistake in our hospitals, that they advise EEG directly. EEG cannot detect the seizures directly. You will advise EEG after you investigate all the tests other than EEG. For example, you will check sodium, you will check calcium, you will check CNS infections, you will check traumas, you will also check the magnesium level, mean that you will also check the creat also, right? So mean that you will advise the patient for electrolytes profile. So I will advise electrolyte profile, RFTs, renal functional test for creatinine, etc. LFTs, right, for detecting the liver problems. Hepatic failure is also the cause of seizure. CT brain. CT brain is for to detect any anatomical injuries or any CNS infections. I will advise also MRI. brain MRI, right? From these investigation, you will get the cause. More than 90% chances are you will get the cause from here, right? If all the tests are normal, now you will go for EEG, electroencephalogram, right? Paper ki taposuki. These are the investigatory tests for seizures, right? You also cannot go for direct treatment of seizures. You will see 3 points in patient. If the 3 points are positive, you will go for the treatment of seizures, right? But before the treatment, we will see the delirium. Here are 3 wordings: delirium, stupors, and coma, right? These are the 3 things which occur before seizures, right? What are they? Delirium, stupor, and coma. What is the actual difference between these 3 wordings, right? Delirium is something which is related to confusion, right? And this the patient will feeling confusions, right, which occur before seizures, right? This is confusions, right? What is stupor? These are the initial phase of unconsciousness. The patient is feeling that I am going to unconscious state, right? This is called stupor. And the coma is the complete unconsciousness. This is complete unconsciousness. And when these things are exceeded, it will cause seizures. So these are the 3 things which are related to seizures. When a condition exceeded these 3, delirium, stupor, and coma, it will cause seizures. Now here I want to mention that what is the clinical difference between seizures and epilepsy. Epilepsy, the usually CK chekam zamda kam specialization wal chekam book the padvi kida mention shiviri gana, right? Epilepsy and seizures. If the cause is unclear, this is called epilepsy. And when the cause is clear, seizure. You will find that when there is no clear etiology, it is called epilepsy. And when you have clear etiology, it is called seizures, right? So these are the things which are important. From here we will go for the treatment of seizures, but the treatment is not clear yet. Only one type of seizure treatment is clear, which is called status epilepticus. Status epilepticus means when the seizures is long from 5 minutes. Last from 5 minutes. When the seizures exceeded 5 minutes, it is called status epilepticus. And only the treatment is clear for status epilepticus, not for partial, not for generalized, and not for absence seizures, right? So now the treatment of seizures. What are the drugs we can use in the treatment? Barbiturates and Benzodiazapines, right? The first, but one thing you will remember that we cannot go for the treatment of seizures until we see the 3 points. in the patient. The first is when the patient have seizures family history. The first point. Criteria for starting seizures treatment. You cannot start the treatment of seizures directly when you see the seizures first time or one time, right? Criteria, the first is if patient have, you will start the treatment seizures treatment when first the patient have family history of seizures, right? The next, if the patient presenting neurological signs, if the patient showing or presenting their neurological signs, and the next is if the patient have abnormal MRI or abnormal CT. These are the 3 points. One is must for starting the treatment of seizures. First is, this is the criteria for starting the seizures treatment. The first is when the patient have family history of seizures and you see the seizures in patient, you can start the treatment of seizures. If the patient have presenting neurological signs of seizures, you can start treatment. If the patient have abnormal CT or MRI, you can start treatment. Otherwise, you cannot start the treatment of seizures when you see the seizure first time in patient. पख्तो के वक्त रेखा treatment मंगो वर्को the seizure. फुटो चिताला patient के. Now we will discuss the treatment of seizures. मैंने कहा शुरू बासे. Now we will go for 2 things: the starting of seizures treatment and withdrawal of these medications. How we will withdraw the medication, how we will stop the medication to this patient, and how we will start this medication. We already have discussed the criteria for starting the seizures treatment. The first is if the patient have family history, if he or she is presenting neurological signs, if he or she have abnormal CT or abnormal MRI, right? Now the treatment of seizures. Drug of choice for these seizures. There is no drug of choice for seizure because the barbiturates, phenobarbital and valproic acid have same efficacy, right? But here is some orders of treatments in seizures treatments, right? For example, first, when we are starting the treatment of this, we will give the benzodiazepines. After confirming these 3 points, right, we will start. The main drug which are given to this seizure patient is William diazepam, right? Diazepam, bromazepam, lorazepam, alprazolam. Right, these are the drugs in this class. We give these drugs intravenously. Intravenous IV, right? We will see the patient. If this patient is relieving or he or she is getting some relief, we will continue this treatment. But if these drugs have no effect on the patient, we will add Phenobarbital. But we will add the drug Pheneton, right? But here, pharmacological points, Pheneton have very dangerous adverse effects. There are two. What are they? Taso pharmacology भी ले रखा ना? बोले ना दबे ले. हाँ? We will replace this Pheneton by Pheneton. Why? Because this Pheneton, and we will replace this by, mean that we will try treatment of seizures. First we will give Benzodiazapines, alprazolam, bromazepam, diazepam, etc. Then we will go for Barbiturates. These are Barbiturates, Pheneton, right? But Pheneton have severe adverse effect. What are they? The first is hypotension. It causes severe hypotension, and if you will cause by hypotension, the seizures will be enhanced, right? It will be go to severe case, right? The next is AV block. What is AV block? Atrioventricular block. Atrioventricular block. What is atrioventricular block? For example, if I have heart, this is heart, this is right atrium, this is right ventricle, this is left ventricle, this is left atrium. The conduction system between the atrium and ventricle, right? This impulses will be stopped and the heart will not contracting enough, right? So these are the side effects of Pheneton. So in place of Pheneton, we will give Pheneton because this drug have no adverse effect like AV block or hypotension. Borekha chikala manga da seizures chire no da siri. This is the abnormal electrical activity in brain. When we are giving Pheneton, it will also affect the electrical activity of heart, right? So we replace this Pheneton by Pheneton, right? Pheneton. After this, we also give the alternative drugs, like for example, gabapentin. If the patient is not relieving with these medicine, we will add which thing? Alternate drugs. The one drug which is very important is gabapentin. We will add this drug also to patient for relieving. If the patient is not relieving with these three medicines, what we will do? We will now go for neuromuscular blockers. We will go for neuromuscular blockers. What are neuromuscular blockers? These are the drugs which blocks the junction between neuron and muscle. What is the activator? Acetylcholine. What is the antidote? Succinylcholine. Right? So we will give succinylcholine blocks the impulses between neuron and muscle, right? When coronium these are the neuromuscular blockers, but remember that these are the drugs which are not used for the treatment of seizures. This is only used for the intubation of patient. When you give succinylcholine or other neuromuscular blockers, the patient muscles will be relaxed and now you are easily intubate patient and give general anaesthetics. General anaesthetics, like for example metazepam or propofol. These are general anesthetic drugs, right? But remember that when you are trying to give propofol drugs, these are the final step of the treatment of seizures. When you are giving propofol or general anesthetics, the patient must be on ventilator because it blocks the breathing, right? So the patient must be on ventilator. Right? Boreus. Chikala Padibande Kar Unishi, right? Now, if the patient is not relieving, you will go for surgical repairment, surgical procedures. If the patient have tumor, you will remove the tumor. If the patient have blood in brain, you will remove the blood from brain, right? If the patient have imbalance, electrolyte balance, you will correct it, right? What are the types of seizures first? Types of seizures. There are three main types of seizures. One is partial seizures. Second is tonic, clonic seizures. Third is absence R. It is also known petitmal seizures. Right? These are the three types of seizures. This partial seizures, as the name indicate, this partial seizures will occur in one part of body. Like for example, the seizures occur in hand or in leg. This is called partial seizures, right? The tonic clonic seizures. Partial seizures are of further have two types: the simple partial seizures and complex partial seizures. In simple partial seizures, the patient will be not unconscious, and in complex, the patient will unconscious, right? In conscious state, a patient will be in conscious state in simple partial seizures, and in complex, the patient will be unconscious, right? The main class thing. Right? Tonic clonic seizures, these are also known as generalized seizures. This is the main type of seizure, right? In which the stiffness of this tonic is for stiffness of muscles occur, and clonic is jerking of muscles occur, right? And this treatment is for this tonic clonic seizures, right? This is absence seizures. In absence seizures, the patient seems normal, right? The patient seems normal, and we are looking that the patient is looking to something, but the patient is actually not looking to anything. He is just thinking, right? This is absence seizures, and this is normal. This lasts just in 2 or 3 minutes, right? The drug of choice for this absence seizures is ethoxamides. Ethoxamides is the drugs of choice for absence seizures, right? This is the treatment of seizures. Withdrawal of these treatments. Medication withdrawal. How you will withdraw? The treatment must be cared for 2 years, minimum for 2 years. If the patient have no seizures in coming or in 2 years, you will now stop the medication. The patient